Hi everybody, we're going to talk about the reproductive systems. This is the last organ system we cover in this course. We'll talk through male reproductive anatomy and physiology, and then we'll do the same for the female. We're going to start on page 126 of the course pack, so if you'd like to follow me there. We will first start by talking through these four terms. So reproductive organs or sex organs are known as gonads. In a male, those gonads are called testes. In females, they're called ovaries. When we talk through physiology, we'll talk more about the gametes, which are haploid sex cells. In males, they're known as sperm. In females, they're known as eggs. We'll also talk about fertilization and zygote formation when we discuss the female physiology of reproduction. So these are terms that we'll get to in some later videos. First, let's target the male reproductive system and the anatomy. We'll first talk through the testes. These are the two gonads or organs that produce sperm. We will then talk about the duct or tube system that carries those sperm to the outside of the body. Those tubes include the epididymis, there's a pair of them, ductus or vas deferens, again a pair, ejaculatory ducts, another pair. They're the terminal portions of those ductus or vas deferens tubes. And then finally the urethra. So in this picture you can see the testes are housed outside the body in a sac called the scrotum. So we'll circle those down here. So you may wonder why the testes are outside the body when it would make sense for them to be more safely housed inside the body where they're offered protection. And it's all about body temperature. The testes are housed outside the body where it's cooler. Sperm production is maximized when the body temperature outside is 3 degrees Celsius less than body temperature. And there's even muscles in the scrotal sac that help to move the testes closer to the body for warmth or farther away, all about maximizing that sperm production. Let's take a look inside of a testis. You will notice at this big picture view there are tubules inside called seminiferous tubules. Makes sense because this is the beginning of making those sperm. So sperm here are made through mitosis and meiosis. They then travel up here to this epididymis where the process of maturation is complete. Let's zoom in for a closer look. Here you can see those seminiferous tubules where new sperm are made. And you can see in between there are cells called interstitial cells. Technically here they're called Leydig cells or interstitial cells of Leydig. Nowadays we often just call them interstitial cells instead of invoking the person who discovered them, his name. So those interstitial cells make testosterone, which are important for sperm maturation. And you can see these tubules here create these spermatids and spermatocytes. All right, so these are all terms that we're going to talk about a little later on when we discuss the process of making sperm. So when sperm travel to the epididymis, they spend about 20 days traveling the 20-foot tubing in the epididymis. They then are ejaculated from the epididymis to the ductus or vas deferens, through an ejaculatory duct, and then to the urethra. I've put the urethra down below because it is not only a passageway for urine, it's also a passageway for semen. So let's go back and look at this picture. You'll notice the epididymis is a set of coiled tubes on top of the testis, and it connects to these seminiferous tubules, and it terminates here when we begin with the vas deferens, right there. So this epididymis is the site of sperm maturation. It's where sperm grow tails, and when ejaculation occurs, the smooth muscles in the walls of these epididymis tubes will contract and propel the sperm toward the vas deferens. Now, if sperm are not ejaculated, they can be reabsorbed into the circulation by the lymphatic system. So it's not that the testes will continue to house more and more sperm. They are destroyed by phagocytes and carried off by that lymphatic system. So let's now travel next to the vas deferens because that's going to take us on a pathway to the outside of the body. This looks like any typical tube in the body, and there's some smooth muscle here, longitudinal and circular layers. Those layers contract rhythmically through peristalsis to propel sperm along through this tubing. So the ductus deferens or vas deferens is simply a tube that connects the epididymis to the ejaculatory duct. All right, so in this picture you can see the epididymis sitting on top of the testis. You can see this tube starting right here and wrapping around, now traveling into the body through the inguinal canal is the vas deferens or ductus deferens. Notice how this tube loops all the way around the back side of the bladder, and then it connects there to the seminal vesicles and into that ejaculatory duct. So this vas deferens or ductus deferens is simply a tube to transport sperm from their site of production and maturation in the testes and epididymis into the inside of the body. Just wanted to mention as a side note here that a vasectomy will cut or separate the two portions of the vas deferens. This way, sperm cannot travel from the testes up through the vas deferens to the next location in its pathway. This in no way influences testosterone production or even sperm production for that matter. It only stops the transport of those sperm away from the testes. So the lymphatic system will then take away any sperm that are not ejaculated, which of course they're not going to be, that are left there in each testis. I wanted to show you this picture because you can see here the epididymis right there, and inside this tube here would be the vas deferens. This whole group of vessels and vas deferens is called the spermatic cord. And of course, the opening in the body through which this will travel is called the inguinal canal. Sometimes an inguinal hernia can occur for a male because that is the place where the spermatic cord connects to the body. And if a male picks up, say, heavy boxes, does a lot of straining, then a piece of the intestine can become herniated through that inguinal canal. So it's not safe to just take a finger and push that back in because a piece of it may not be adequately pushed through. That can cause necrosis or death of that tissue. It's important to surgically put that piece of intestine back in and then make sure that that hole there is just wide enough for the spermatic cord to pass through and hopefully nothing else. Just another view there of an inguinal hernia. All right, so let's talk about our pathway so far. We have originated with sperm production here in the testes, and we took that sperm to the epididymis where it was matured for around 20 days. The sperm then traveled through this ductus or vas deferens, and that will loop us into the body. We'll come back to this seminal vesicle here in just a bit. Let's take us next to this ejaculatory duct because that portion is the last part of the vas deferens. And you can see in this image, it actually goes through a piece of that prostate or prostate gland. Here again, you can see the seminal vesicle. The vas deferens travels through that. And another really great view right here of an ejaculatory duct. So this prostate looks kind of like a little apple or a strawberry, and it sits at the base of the bladder. You'll notice that the ejaculatory duct is on the posterior side of that bladder. It is going to be transporting sperm and semen toward the urethra. So from there, it will travel down to the urethra. All right, so just another view there. Here you can see that ejaculatory duct once again. It's not labeled in this picture, but here's your seminal vesicle coming through here, and then right through here is where that ejaculatory duct is found. They did label the opening of the ejaculatory duct as we join here with the urethra. So let's turn over to page 127 and now talk about the urethra. So the urethra is a tube that connects the urinary bladder and the male reproductive system to the outside world. You'll notice there's three main regions listed on your sheet. Jokingly, they're PMS, meaning prostatic, membranous, and spongy urethra. So the portion of the urethra right here in the prostate region is called the prostatic urethra. The membranous one is next. And that is the distance from that portion there to the penis, so about right there. That's going to be our membranous urethra. and the rest of the length here is going to be, of course, the spongy urethra. So we know the urine passes through here from the bladder, and we also know that semen can pass through here from the male reproductive tract. However, they're not meant to pass simultaneously, so there is a small sphincter here that will close off the passage of one while the other is traveling through. That way we don't get the semen and sperm killed by the acidic urine. So speaking of semen, let's now talk about these accessory glands. Let me get you a list. So we're going to talk about seminal vesicles, prostate, and bulbourethral gland and their contributions to making semen. Of course, sperm and these secretions are what we consider to be semen, and semen needs to be slightly basic to counteract the acidity of a female's reproductive tract. In one ejaculation, a male may produce as much as 2.75 to 3.5 milliliters of semen. Each subsequent ejaculation over the course of the same day may be less and less. You'll notice on your worksheet there, about halfway down the page, each ejaculate contains between 50 and 150 million sperm per milliliter. So if you're talking about 4 milliliters or so, that's a lot of sperm. That's like 450 million sperm. Just think, imagine if all of those were to become an actual pregnancy. So seminal vesicles, we've looked at those already. They produce the majority of semen, and their fluids are thick and yellowish. They activate sperm and neutralize a female's acidic secretions in the vagina. The prostate also secretes a milky, sugary fluid that activates sperm as well and improves the motility, or the ability for those sperm to swim. The last gland listed here is the bulbourethral gland, sometimes called the Cowper's gland, and these paired glands release a clear mucus that we suspect cleanses the male urethra of acidic urine. You know, acid's not good for sperm, it can kill them, so we want to ensure that the only acid these sperm encounter is in a female's reproductive tract. I want to show you this picture because you can very clearly see the seminal vesicles sitting at the posterior side of the bladder. There's a pair of those. You can easily see that over here on this picture. And you can see this strawberry-shaped prostate gland sitting right here. And you can also see the sphincters that close off the opening of the urethra right up here when a male is going to ejaculate, because we of course don't want urine passing through these tubes at the same time as semen. Also, this gives us a nice clear view of the ejaculatory duct here passing through the prostate, and you can see how the prostate completely encircles that urethra. So what was the name of that particular portion of the urethra? This portion of the urethra in here is called prostatic urethra. Now, I'd like to show you this picture because if that prostate gland becomes enlarged or hypertrophied, it can squeeze around that urethra, making it difficult to urinate. So this picture on the right does show an enlarged urethra, or enlarged prostate with damage to that urethra. Now, at the very bottom of page 127, let's talk about the external genitalia for a male's reproductive system. That includes the external scrotum and the penis. So in this image, we can see the scrotum, which is a hair-covered sac that houses the testes outside the body. And we can also see here in this picture a circumcised penis. This penis is, you can see the shaft, which is this portion here. And you can see the glans penis, which is sometimes called the head of the penis. But this particular penis has no prepuce or foreskin. That's been removed. Had it been in place, it would have covered this portion here of the shaft. All right, so that should take us down to the very bottom of page 127. There is an image for you on 128 and some practice problems there. Please follow me to the next video. We will talk there about spermatogenesis and spermiogenesis starting on page 129.